Hi friends, so today we'll discuss about atopy in dogs. Atopy is a cutaneous form of allergy in dogs. So allergy can manifest in different ways. In humans it mostly manifests as asthma or respiratory issues, and in dogs it most of the time manifests as cutaneous issues, skin itch. So when it comes to allergies, there are three kinds. One, it could be flea allergy. Two, it could be food allergy. Three, it could be environmental allergy. Atopy most often refers to environmental allergy. So flea allergy happens when there are fleas on the dog, and fleas, when they suck the dog's blood, they have the tendency to inject some saliva in the skin, and that saliva, it's a proteinaceous saliva and is highly allergic to the dog, and that is how the flea allergy starts. Food allergy is because of food. Certain kinds of protein in the food, if it doesn't suit the dog, it manifests as skin problems. And environmental allergy could be anything. Most commonly it could be dust allergy, house dust mites, it could be roaches, it could be any other thing that is in the house or from anything in the environment. So atopy tends to manifest in dogs when they are somewhere between 1 and 3 years of age, and most of the times it starts at that age. 85% of the cases it happens during that time period only. So how do we actually know if the pet has atopy or not? See, atopy generally manifests with secondary bacterial infection, it's called as pyoderma, or with secondary fungal infection like malassezia, those things. And veterinarians tend to treat for the secondary issues first. If it's a one-time problem, the secondary problem, if it's a one-time issue, then there's not a likely an underlying cause. But if it is recurrent, like if it happens twice a year, once a year, or even once in 3 months, 2 months, a month, like that, then there's likely to be an underlying cause. That is when we suspect atopy. Certain kinds of atopy can be seasonal, certain kinds of atopy can be non-seasonal. So seasonal atopies are generally allergic, those dogs are allergic to the pollen, and especially in flowering plants that generally blossom once a year or twice a year. So history taking should be proper. If you know whether it's seasonal or not seasonal, you will be able to rule out few causes of atopy. Factors that contribute to atopy, generally one thing is the genetics of the dog. There may be a genetic involvement as well, and the lifestyle of the dog, whether the dog is indoors, outdoors, or it goes inside and outside, and diet and nutrition of the dog. So atopy generally has a pattern, in the sense the lesions are generally localized to the paws, the nose, around the eyes and the ears, and sometimes around the anal areas as well. So as clinicians, we tend to suspect atopy when the following criteria is fulfilled. First thing, the age of onset. If it's less than 3 years, it can be atopy. Second thing, it could be a corticosteroid responsive pruritus. That is, one dose of any steroid, it responds to more than 90%, or the pruritus abolishes. Third thing is, if the dog is mostly indoors and doesn't go outdoors as often. And the fourth thing is recurrent bacterial or fungal infection. No matter how many times you treat the secondary problem, it keeps recurring again and again. The next criteria is if the front limbs are affected, especially the paw area and the ear pinna are affected. However, the ear margin should not be affected and the dorsal lumbar area should not be affected. So these 8 points are called as Favreau's criteria. If the patient fulfills 4 or more than 4 criteria among these, we can suspect atopy, and it is almost 85% sensitive. So ideally, treating atopy would be to find the underlying cause or the underlying allergen, but that doesn't happen in almost 99% of the cases. You really can't know which is the exact allergen that is causing all the symptoms, or in some cases, or most of the cases rather, it will be the other way around. They will be allergic to multiple things at the same time. So they could be allergic to something in the food, they may have fleas or environmental allergy as well. So there are a few ways to know what they are allergic to, like the serum allergy test and intradermal allergen testing. All those things have their own pros and cons, but it is better to know what they could be allergic to. And once we know, the first treatment is to avoid those allergens. So if your dog is allergic to food components, like for example chicken or beef or something like that, then you need to try a novel protein based diet or a hydrolyzed protein diet. So novel protein, like the name suggests, is new protein actually, something that your pet has never been exposed to in its life. Like if it has been eating chicken or beef, you can try feeding your pet something like salmon or turkey, etc. In some countries, beef, venison, those things are also being made actually. So in hydrolyzed protein, the protein molecules are chopped into smaller pieces, so small that the immune system cannot mount an immune response. So what happens is, a dog that is allergic to chicken protein won't be allergic to hydrolyzed chicken protein. So for atopy, the first line of treatment is always corticosteroids. Corticosteroids tend to abolish pruritus. It works as a diagnostic criteria as well in Flavreau's criteria, and it helps to reduce pruritus and improve the quality of life of the pet. And but sometimes corticosteroids can have some unwanted side effects like polyuria, polydipsia, polyphagia, etc. And if any pet has severe reaction to a corticosteroid with the said effects, then we have to switch over to immunosuppressants. However, on the long run, corticosteroids may not be used as a maintenance. It helps to abolish pruritus and it works like magic, but that cannot be continued as such, in which case we have to switch over to an immunosuppressant. So immunosuppressants like cyclosporin, azathioprine, those things have been used for atopy. So steroids and immunosuppressants are conventional methods of treating atopy. However, there are newer medications like oclacitinib, etc., which are Janus kinase inhibitors, have less side effects and almost guarantee abolishment of pruritus as much as a steroid would do. So as and when the disease flares up, your vet will be starting the medications to abolish the signs, and later he will be asking you to continue on the maintenance medications. And one note here is dogs that are on maintenance for atopy with immunosuppressants have to undergo regular blood checks for liver and kidney function every 2 to 3 months once. This is very important so that these medications don't affect them in the long run. So to sum up, atopy is an allergic disease that happens in young dogs less than 3 years of age, and it has a pattern of manifestation like I explained with the Fabreau's criteria, and it is a chronic managemental disease which requires lifelong treatment and monitoring. I hope that this video was informative, and please subscribe to the channel for more videos. Thank you.